Right now, 400 kilometers above your head, six people are living inside a sealed metal structure hurtling around the Earth at 28,000 kilometers per hour. They are among the most carefully screened, physically tested, and medically examined humans on the planet. Every one of them passed years of health evaluations before launch, and none of that matters because the human body doesn't care about your resume. Kidneys still form stones, appendixes still inflame, hearts still develop irregular rhythms, teeth still abscess. And when any of that happens on the International Space Station, there is no ambulance, no emergency room, no surgeon, and in most cases, no doctor on board at all. The nearest hospital is a 4-hour free fall through the atmosphere, inside a capsule that has to be prepared, undocked, and landed, assuming one is even available. This is the story of what happens when the most isolated humans in existence get sick. Let's start with what's actually on board. The ISS carries a medical kit, and calling it a kit is generous. It's closer to a very well-stocked first aid station, packed into a few lockers in the station's service module. It contains medications for pain, infection, allergies, nausea, sleep disruption, and cardiac events. There are basic surgical tools, a defibrillator, a portable ultrasound machine, and equipment for drawing blood and administering IV fluids. There is a manual, a detailed step-by-step medical reference guide that reads like a cookbook for emergencies, written so that someone with basic first aid training can follow instructions and perform procedures they've never attempted before. Because that's exactly the scenario NASA is planning for. On most ISS crews, there is no physician. Astronauts are trained in emergency medical procedures before launch, roughly 40 hours of training that covers CPR, wound closure, injections, IV placement, dental emergencies, and basic ultrasound operation. One or two crew members are designated as the crew medical officers, the people the rest of the crew will turn to if something goes wrong. These are not doctors. They are engineers, physicists, and military pilots who took a crash course in medicine. They can suture a wound and read an ultrasound image, but they cannot perform surgery, diagnose complex conditions by feel, or make the kind of split-second clinical decisions that emergency physicians train for over a decade to master. So what happens when something goes wrong? The first call goes to the ground. NASA maintains a team of flight surgeons at Mission Control in Houston available 24 hours a day. These are actual physicians, experienced in aerospace medicine, who can consult with the crew in real time via radio or video link. The crew describes the symptoms. The flight surgeon asks questions, requests vital signs, and talks the crew medical officer through an examination. It's telemedicine at its most extreme. A doctor trying to diagnose a patient they can't touch, in an environment where every symptom might behave differently than it does on Earth. And that's the part that makes space medicine genuinely strange. The human body in microgravity doesn't follow the same rules. On Earth, if you have appendicitis, the pain localizes in the lower right abdomen. In microgravity, the organs shift. The appendix drifts upward. The pain might appear in the center of the abdomen, or near the chest, or nowhere specific at all. A flight surgeon trying to diagnose appendicitis through a video call, with a non-physician operator performing the examination in a patient who is floating rather than lying down, is working with a playbook that was written for a different planet. Some conditions are genuinely harder to diagnose in space, not because the instruments are worse, but because the body itself is presenting the wrong clues. Blood behaves differently too. On Earth, when you cut yourself, gravity pulls blood downward and away from the wound, which helps surgeons see what they're doing. In microgravity, blood doesn't drip. It forms floating spheres that cling to surfaces by surface tension, pooling around the wound in a shimmering red dome that obscures the tissue underneath. A simple laceration that any nurse could handle on Earth becomes a visibility problem in space. And if the wound requires cauterization, the smoke and aerosolized blood particles don't rise and dissipate. They float in the air, contaminating the breathing environment of the entire station, unless a vacuum system captures them immediately. NASA has thought about the worst cases. What if an astronaut needs actual open surgery? The honest answer is that it has never been done in space, and the station is not equipped for it. Researchers have designed enclosed surgical pods that would contain floating blood. Robotic surgery guided from the ground has been discussed, though the communication delay between Earth and the ISS, roughly half a second round trip, makes real time remote surgery dangerously imprecise. A half-second lag in a scalpel movement is the difference between cutting tissue and cutting an artery. For missions to Mars, where the delay stretches to 20 minutes each way, remote surgery becomes physically impossible. The more practical solution is evacuation. If a medical emergency exceeds the crew's ability to manage it, the protocol is to put the sick astronaut into a Soyuz or Crew Dragon capsule and bring them home. This sounds straightforward. It is not. Preparing a capsule for undocking takes hours. The descent takes roughly 3.5 hours more. And the re-entry subjects the patient to forces of up to 4 or 5 G, meaning the astronaut's effective body weight quintuples during the most violent phase. For someone with a spinal injury, internal bleeding, or an unstable cardiac condition, the re-entry forces alone could be fatal. The rescue might kill the patient faster than the disease. There have been real medical events on the station, though the details are often kept quiet. Astronauts have developed blood clots in space, a condition linked to the way microgravity alters fluid distribution in the body. Blood pools in the upper body and head instead of the legs, and the altered flow patterns can trigger clotting in the jugular vein, one of the largest veins in the neck. In at least one documented case, an astronaut was diagnosed with a deep vein thrombosis via ultrasound while on the station, and treated with blood thinners guided by a hematologist on the ground. The astronaut completed the mission and returned safely, but the case sent a shockwave through the aerospace medical community. A blood clot that dislodges and reaches the lungs is a pulmonary embolism, and it can kill in minutes. There would have been nothing anyone on the station could have done. Dental emergencies are another quiet fear. Astronauts undergo extensive dental work before launch, every filling checked, every questionable tooth addressed. But teeth are unpredictable. An abscess can form with no warning, and performing a dental extraction in microgravity, where the patient is floating, the blood is forming spheres, and the only dentist is an engineer with forceps and a laminated instruction card, is a scenario every flight surgeon hopes never arrives. Mental health is the frontier that NASA is only beginning to discuss openly. 6 people in a sealed space the size of a large house for 6 months, with no possibility of leaving, no fresh air, no privacy. Sleep disruption is nearly universal, caused by the station's 90-minute day-night cycle, 16 sunrises every 24 hours. The pharmacy on board includes sleep aids and anti-anxiety medication, and private counseling sessions with ground-based psychologists are scheduled regularly. But if a crew member experiences a genuine psychiatric crisis, a psychotic episode, a complete breakdown, the protocols become vague. There are no restraints designed for that purpose. There is no isolation room. The other 5 people are stuck in a tube with someone who may not be in control of their actions, and the nearest help is a 4-hour re-entry away. The space agencies have built the most extraordinary outpost in human history. But inside those walls, astronauts are still human. They still get sick, still break bones, still have hearts that can stop without warning. And the entire medical strategy comes down to a simple, uncomfortable truth. Treat what you can, stabilize what you can't, and pray that nothing happens that requires more than a first aid kit, a video call, and a very brave engineer pretending to be a doctor. But getting sick in space isn't even the most expensive emergency caused by a single object being stuck in the wrong place. Back on Earth, there's a narrow strip of water that 12% of all global trade passes through every single day. And when a 400-meter container ship turns sideways inside it and stops moving, the entire world economy starts bleeding money at a rate of roughly $10 billion a day. What actually happens behind the scenes when a ship blocks the Suez Canal is a chaos of tugboats, lawyers, and geopolitics that makes a space station emergency look simple. That story is next. And if you don't want to miss it, you know what to do.